Greetings to all. This is Bhavna S. Badikar from first year MSc Biochemistry Department. And my topic is phenylketonuria, and I'll be talking a few words about it. So, what is phenylketonuria? This is a birth defect that causes an amino acid called phenylalanine to build up in the body. This is an inherited genetic disorder and it is due to the mutations in PAH gene, which results in low levels of the enzyme phenylalanine hydroxylase. And this results in the buildup of dietary phenylalanine to potentially toxic levels. So, this is the autosomal recessive metabolic genetic disorder. And in this disorder, the high concentration of phenylalanine is accumulated in the blood, which leads to the excretion of phenylalanine in the urine. So, when the PAH activity is reduced, the phenylalanine accumulates and it gets converted into phenylketone, which can be detected in the urine. Now, let's know about the metabolism of phenylalanine. So, phenylketonuria is also called as PKU. So, in PKU, we all know that it is an inborn error of metabolism transmitted by a recessive gene. It involves a mutation in DNA which causes inadequate production of an enzyme that is needed or required for metabolizing phenylalanine, which is an amino acid. In utero, the fetus is unaffected because the maternal metabolism handles the excess phenylalanine. Phenylalanine metabolism is very important as the body can convert phenylalanine into the amino acid tyrosine, which is used up to produce other important molecules. And these important molecules are involved in several aspects of health, including our regulation of mood, brain functioning, stress responses. Now let's know some of the symptoms of PKU disorder. So, PKU symptoms can range from mild to severe, and the most severe form of this disorder is known as the classic PKU. An infant with the classic PKU may appear normal for the first few months of their life. If the baby isn't treated for PKU during this time, they'll start to develop the following symptoms such as seizures, tremors, which is trembling and shaking, stunted growth, hyperactivity, skin conditions, a musty odor of their breath, skin, or urine. If PKU isn't diagnosed at birth and the treatment isn't started quickly, then the disorder can cause irreversible brain damage and intellectual disabilities within the first few months of life. And it can cause behavioral problems and seizures in the older children. Now, let's know about some of the important types of PKU. So there are five major types of PKU. So the first type is also called as the classical type of PKU, and the biochemical abnormalities associated with this is the total deficiency of phenylalanine hydroxylase. And the second type is also called as the variant type, which is the partial deficiency of phenylalanine hydroxylase. And third type is also called as the transient type of the PKU, in which it is the delay maturation of the phenylalanine hydroxylase. And the fourth type of the PKU is the deficiency of dihydroruptor in reductase deficiency. And the fifth type is the defective in synthesizing of dihydrobiopterin and dihydrobiopterin synthetase. And the maternal type of the PKU is the genetic inborn error, where the mother has hyperphenylalanine anemia in her. So the PKU affected infants. Some of the newborns or the infants with the PKU initially don't have any symptoms at all. However, without treatment, the babies usually develop signs of PKU within a few months. In the United States, PKU is most common in the people of European or Native American ancestry. It is much less common among people of African, Hispanic, or the Asian ancestry. And some of the diagnoses of the PKU are, so in you know while testing of this PKU, it is usually done for a baby which is a day old or 2 day old. For the most accurate results, the test is done after the baby is 24 hours old and after the baby has had some protein in their diet. It is easily detected with a simple blood testing. And one of the type of diagnosis of PKU is the Guthrie test, in which here it involves the doctor using the Guthrie cards or the special cards to collect the capillary blood from the infant's heel, and then these cards are further saved up for later testing. And the second one is the ferric chloride test, where the phenylketonuria in the urine can be detected by this test by the appearance of a green colored in the test, and this test is not specific. And the third type of diagnosis that is usually done is the DNA probes, in which the gene for human PA hydroxylase has been cloned. So the paternal diagnosis of PKU can also be done by DNA probes. And then we have the treatment of PKU. There is no proper cure for PKU, but treatment can prevent some of the intellectual disabilities and other severe or serious health problems. So, treatment with medications or dietary changes can help reduce symptoms. Following a low phenylalanine diet and avoiding high protein foods can be helpful. And then the prevention is better than the cure, so there is nothing the parents can do about this, because by the time the parent realizes that the child has PKU, it would be too late. And the mother with the PKU could be on a diet free, which is a diet free of proteins. And then one of the best or the effective preventive method is following up a low phenylalanine diet. Nutritional supplements designed for people with PKU can ensure enough protein and nutrition during pregnancy, and avoiding all sorts of high protein foods does all the good, and limiting the natural protein intake, that is under 10 gram per day, and consuming very low protein foods, and special low protein prescription food intakes, and taking of the protein substitutes which are usually available in the liquid pouches, and these protein substitute has to be taken at least 3 times a day. So following up such sorts of low alanine diets, the treatment can be done, and it is one of the very effective preventive measure that can be followed in order to reduce the symptoms of phenylketonuria. Thank you.